In this panel, we're going to hear from two experts and two longtime allies, the American Association of Kidney Patients, on how patient consumer demand is driving innovation in kidney diseases. Our next guest is Dr. Murray Sheldon, who has a very unique background. Dr. Sheldon is a very well-known cardiac surgeon. He is somebody that has owned his own medical device innovation company, and he serves as a senior advisor at the United States Food and Drug Administration for medical devices. There's one thing about Dr. Sheldon that we're very proud to know personally, and that's his deep empathy for patients and the suffering that they go through when they have a chronic disease and kidney failure. He has a sense of urgency about his work, and that urgency reflects the urgency that we have as patients. He has a dedication to making certain that new innovations that are safe get into the marketplace to preserve more lives and to give us the tools that we need to operate independently. Dr. Sheldon, go right ahead.
I would like to thank the American Association of Kidney Patients for the opportunity of presenting my vision for the future for people with kidney failure. Apparently, according to this first slide, the future is already here. And I suppose that's true, as we are already in the decade of the kidney. And while there very well may be several visions and versions of the future, we will undoubtedly need to develop artificial organs. As for at least in the near future, the world will not have a sufficient supply of human kidneys for transplantation, which is currently the gold standard for kidney failure, and to have enough of these human kidneys for everyone who develops kidney failure. So this is my vision, not necessarily the vision of the FDA or anyone else, but we've already heard from my colleague and friend from the Netherlands on various technological and ecological issues. I'd like to share with you today my ideas of how we can actually achieve this vision. In March of 2012, the American Society of Nephrology, ASN, expressed concerns to the FDA regarding stagnancy in product development relating to kidney health. ASN recognized that there was a particular lack of innovation in nephrology, with only 4 new drugs developed since 2007 and a persistent 5-year survival rate from kidney failure, worse than most cancers. Then came the Kidney Health Initiative. This was created in September 2012 by a memorandum of understanding as a public-private partnership between the FDA and the American Society of Nephrology. It was created with a goal of promoting innovation and patient safety for kidney disease, but its primary mission is to catalyze innovation and the development of safe and effective patient-centered therapies for people living with kidney disease. Over the next few years, KHI has brought together all of the necessary stakeholders from all over the world, some of which are shown here, to enable the greater kidney community as a whole to provide either the right drug, device, or biologic for administration to the right patient at the right time by fostering partnerships that have facilitated development and delivery of those products and addressing challenges that impede these goals. KHI's members are in excess of 100 organizations, including patients, regulators, industry, healthcare providers, academics, and other government agencies. In 2016, KHI responded to the Executive Office of Science Technology Policy challenge on organ donations and transplants with a commitment to identify the scientific, technological, and regulatory milestones needed to achieve the goal of creating a bioartificial or bioengineered alternative to dialysis as renal replacement therapy. This effort resulted in the development of the 2018 Scientific and Regulatory Roadmap for Innovative Renal Replacement Therapy. Now, the roadmap was designed also as a catalyst for patient-centered investment and innovation. initially focused on improving the quality of life for people with ESKD by redesigning dialysis, and to support the implementation of the technology roadmap, a funding mechanism known as KidneyX was also created as a public-private partnership, this time between the U.S. Department of Health and Human Services and the American Society of Nephrology. By combining the power of prize competitions with the technology roadmap, multiple prize competitions, as you can see on this slide, were created and executed, culminating with the current Artificial Kidney Prize Challenge competition, which is ongoing as we speak. And KidneyX brought together the communities of innovators, patients, providers, and others to KidneyX summits held annually since 2019. So one of the first take-home messages is that significant progress can be made if you provide a platform and meeting place to bring together all of the needed expertise in one room sometimes or in one virtual community. The KidneyX summits were those meeting places before COVID, but the international consortium that will be next developed will become the next platform around the world. And I say around the world because kidney disease is a worldwide problem, which affects more than 850 million people, or approximately 11% of everyone on this planet. From the Institute for Health Metrics and Evaluation Global Burden of Disease study in 2017, chronic kidney disease was identified as the 16th cause of early death, but it is poised to increase to number 5 by 2040. And the International Society of Nephrology Kidney Health Atlas of 2019 has estimated that by 2030, 14.5 million people around the world will have end-stage kidney disease, yet only 5.4 million will be treated due to economic, social, and political factors. Additionally, more than 2 million people will die each year due to little or no access to hemodialysis or kidney transplantation. Not only does this result in an enormous financial burden for the healthcare systems worldwide, but as Foucault has shown in his recent talk, it also contributes enormously to the world's ecological burdens of plastics and water. Further, end-stage kidney disease is increasing in prevalence most rapidly in countries with emerging economies, generally due to increased cases of diabetes and high blood pressure. These worldwide issues require worldwide solutions. Yet, for the past 70 years, since dialysis was invented by Willem Kalf in the Netherlands in 1943, there has been little innovation in dialysis or transplantation, especially in comparison to other diseases and other technologies. But as described earlier, there are various activities being developed to address this problem, including the Kidney Health Initiative and its sister organization in Europe called the European Kidney Health Alliance. And we've identified, at a minimum, 22 groups worldwide actively pursuing different aspects of what will eventually be needed for implantable artificial kidneys. Unfortunately, many of these groups, if not nearly all of them, are working in silos and they're not getting together and communicating and helping each other. What do we have so far? What has been done? We have developed fairly good vascularized kidney organoids. And as you look at this slide of the microscopic picture, they kind of look pretty real and they tend to function. So we have some starts, mostly out of Australia, and this actually comes from Harvard from Joe Bonventry. And there are also implantable bioengineered kidneys being developed at the University of California, San Francisco by Shuvo Roy and Bill Fissell that combine both filtering systems as well as bioreactors to get both the sieve factors for filtering and cellular function combined. And Victor Gura in UCLA has developed wearable artificial kidneys. And at Miramax, there have been new developments on decellularized animal kidney scaffolds. And in Europe, peritoneal dialysis, this is in Singapore, peritoneal dialysis from AWAC has been developed to allow patient mobility. Now, what you don't see on this slide, because I haven't had time to put it on, is the recent experience that we've seen with xenotransplantation, where CRISPR-Cas9 engineered pigs who have had removal of certain immunogenetic factors can be and has been transplanted into live humans. These were very difficult and recent procedures, but they have been successful for a few days, and these kidneys have actually developed and made urine. So the whole world of xenotransplantation, which has never achieved reality, is right on the cusp of being developed for human use. Continuous progress has achieved a great start, as all of these examples demonstrate. What is my real vision? My vision is to bring together a wide range of diverse expertise from all over the world, as Foucault must have mentioned in his talk called the Bundling the Best Brains, to work together to develop a variety of implantable artificial kidneys and to manufacture sufficient quantities worldwide so at least one type of implantable artificial kidney would be available to everyone on Earth who has end-stage kidney disease and cannot otherwise get a compatible human donor kidney. The unfortunate reality is that current dialysis is very far from the green technology that we've also sought, and no matter what we do to lessen the ecological burden, it will never become truly green technology. But to make a huge impact, to actually eliminate the use of massive amounts of plastics, water, energy, and other non-renewable factors, we must replace dialysis of any type as the mainstay therapy for end-stage kidney disease, as it was originally intended to only be a temporary short-term bridge to implantable solutions by creating and manufacturing a variety of implantable artificial kidneys. It is the intent of the international consortium to provide the pre-competitive space that is needed to bring together anyone and everyone developing components that could aid in these implantable artificial solutions. Success of the consortium will result in green kidney replacement therapies. The development of this consortium will be driven and led by patients, as only they have the lived experiences that are critical to create patient-centered innovation. And as this vision has been patient-led by the American Association of Kidney Patients and their sister organizations in Europe, we hope that we will all function together as one group. I want to be sure that I leave you with this notion. This is an African proverb. It says, if you want to go far, go alone. If you want to go fast, go alone. If you want to go far, go together. And we definitely want to go far. We want to be disruptive. and we don't want to build a better dialysis machine. So we all need to go together. I'd like to thank you for the opportunity for presenting this information and look forward to our future together. Thank you.
Thank you very much, Dr. Sheldon. We appreciate your ongoing advocacy for patients across the globe. And I'd like to thank FOCO again for being with us. Thank you both.